Hi, everybody. I am so excited about our guest today, Dr. Mary Clifton, who is a board certified licensed internal medicine doctor practicing in Manhattan, and she's a recognized expert in CBD and cannabis. So, welcome, Dr. Mary.
Thank you, Holly, for inviting me.
Why don't you tell everybody what inspired you to actually get involved with cannabis and CBD as part of your practice?
Well, I've been a practicing internist for 25 years, and I've been writing a cannabis card here and there for medical necessity for patients and not really thinking too much about it until a few years ago when I had a couple of very significant experiences. I had cancer, and shortly after that experience, one of my good girlfriends died. And I had to be in both of those cases more personally involved in those deaths than I usually am. I mean, I'm an internal medicine doctor. We take care of older people, and it's not unusual for a couple of people in my practice to be in a hospice process at any one point. So I'm used to taking care of hospice patients and used to working with the death and dying, but not at the bedside for hours at a time, like I was with my brother. And I was really, unfortunately, in that circumstance, not able to get good control over his experience, even with everything that I had at my disposal with Western medicine. And it was a very symptomatic and a difficult death, difficult for us to witness and difficult for him to experience. And then when my girlfriend experienced recurrent ovarian cancer and I was able to work very closely with her, her symptom control was so much better with using cannabis. So I thought that was probably just a coincidence because all we ever hear as doctors is that there's no data and you shouldn't make these recommendations. Actually, there's a lot of data. And the more I dove in, the more I realized that there's just so much that I didn't know that I need to know. And probably a lot of other doctors are in the same place. So I started shooting these videos, and that was about, a year and a half ago. And I've shot about 100 now, individual educational, hopefully humorous and entertaining and beautiful videos that people can watch to learn about how to use cannabis and CBD for all kinds of conditions.
I'm so happy to have you as a doctor, okay, that believes in this healing plant as a therapeutic, as potential medicine, to give some hope to some patients as an alternative. And I'm grateful to meet people like you because I know that that traditional medicines are important. We can't ignore that.
It wasn't really until the 80s that we started to learn about the endocannabinoid system, the ECS, and we have a lot of thanks to give to the HIV and AIDS community and to the cancer community who were able to come together and say, listen, we're getting benefit here from these medicines, and you guys need to figure out how to get these medicines to us. And that opened up some doors to some research so that people could figure out what exactly was happening. And it turned out the ECS system affects really every organ in the body. But other systems that do the same thing already, and your viewers know systems like the the thyroid, where if the thyroid is off, the entire body is responding to that low thyroid or high thyroid. Or if your adrenal cortical system is off and you're high in cortisone, or more often in our stressful society, depleted of cortisol, and then you're going to experience all kinds of other symptoms. So it affects everything. And the same thing is true of the ECS. You actually have CB1 and CB2 receptors located all over your body on every organ, concentrated, of course, in the central nervous system where they can do their thing to help us with anxiety and pain and stress management, but also located all throughout the rest of the body to help control inflammation and response to stress. So if you, for example, take a biopsy of a colon that's inflamed and irritated, and check that for CB receptors, you'll actually find a higher concentration of CB receptors in that colon, where your body is working to increase the number of receptors and help to reduce the inflammation. Or if you draw fluid off of a swollen up knee and assess that fluid for the naturally occurring endocannabinoids, the cannabinoids that your body naturally creates, you'll find higher levels of anandamide and 2-AG in that fluid in the knee. The body is already utilizing this system and dialing it up and down in various areas of pain and inflammation to help you get control of your symptoms and help you feel better quicker.
So I'm a believer. You have the medical expertise to understand it and to address this with patients of all ages and all different kinds of concerns. So it could be, some people think it's helpful and some people think it's harmful. What is your response to that, about, efficacy and safety?
Well, I don't think that anything is right for everyone. I haven't found anything that works great for everybody except eating more vegetables and getting more sleep. Those are all things we all benefit from, and focusing on your relationships. But over and over in studies, somewhere between 17 to 21% of people just don't like CBD or cannabis. It's not a frank allergy, but it's just more of a dislike of the lightheaded feeling they may feel, or a sense of dissociation, or it's just not their thing. So using these products is not for everybody, but it does help a lot of people. And so if it doesn't work for you, then that's fine. There's all kinds of other mechanisms to manage stress and inflammation that you can explore. But for a lot of people, they get nice results. And it kind of makes sense. This is just a plant. It's not some sort of unusual synthetic pharmacologic formulation. These formulations are derived directly from the plants. And, if we weren't in some crazy prohibition for the last 100 years, these plants would be everywhere because they're not hard to grow. They would be growing in the ditch, or they'd be growing in the farm field where animals would be nibbling on them. So even if you weren't directly inhaling them intentionally, you'd still be getting exposure to the plants because there'd be the pollen in the air, and there would be some concentration in any animal products that you're eating. So it makes sense that they should be included in your regimen.
Is there a delivery method that you prefer?
Oh, well, I think it's really important when you're starting out to see if these products are right for you to choose a delivery method with a rapid onset of action. A lot of people want to do an edible because it seems like a gummy bear or a cookie is going to be easier to take and very innocuous. But the problem with edibles is that their onset of action is anywhere between 60 to 90 minutes out. So almost everyone that uses edibles also has a really bad story to tell about edibles where they took too much and then you really can't extract it once it's in, or they just didn't get a result in time and they felt like it didn't work. So it's easier and smarter, and I think just a better way to handle it to start with inhalation and get a better understanding of how the products are working, and then go to an edible.
Well, I really am so grateful for the information. As basic as it may seem, there are so many people that are so unaware of how this works. And we need to have more education, and that is why we do this. We want to continue to pay it forward. We need other medical professionals to learn from doctors like yourself, because, right, there are a lot of doctors that do not know about this as a therapy, right?
Well, everybody just does their own thing. I mean, medicine is very complicated, and there's a lot to know. So I don't expect everybody to be an expert on everything, but it's nice for other doctors to know if somebody is able to help their patients, so that if for example, when I have a patient with cancer, I can refer them to a cancer doctor and get great care for them. I don't know anything about how to treat cancer, the details about how to administer chemotherapy. So situations like that really require specialization and expertise. So I'm happy to provide that for anybody who needs it for their patients.
I know Dr. Mary has an amazing website. It is cbdandcannabisinfo.com. She has a variety of other content and information, a wealth of information archived on your site. What else do you want to tell our viewers?
Well, I really appreciate the shout out on my site. I didn't expect that, but I really think that the whole movement, the movement forward, is going to rest on people like you. I mean, it's bringing it forward and making it mainstream and helping people to have opportunities to interact with the plant in ways that feel really safe and fun, so that they can imagine that this is something they can integrate into their life without any serious harm. And the risks have been so dramatically overstated in the setting of the war on drugs and in the setting of the prohibition, that it's wonderful to see it lift and to be able to provide straightforward, scientific data to refute all of the stuff that has been going around in mass media for years. But we need doctors, but we also need coaches and growers, and we need people who are creating really beautiful products. I love all the gorgeous products that are available now, and that just keeps getting better all the time. So I think the more that people can integrate these sacred plants into their life, the better off we're all going to be. It's just designed to reduce inflammation and control stress. And I don't think anybody, the fact that we have this ECS system in our bodies really makes me feel like I don't think that we were meant to live in pain or in fear or under a high level of anxiety. That was just not the way we were designed. We're really designed to lead happy lives. And that's what this plant is here to help you do.